Yeah, good afternoon, yeah?
Good afternoon,
Yeah,
Daniel.
yeah, yeah. How you doing?
I'm doing good.
Yeah,
Good to
yeah.
see you today.
Yeah, nice seeing you as
Yeah.
well, man. Yeah. So today we'd like to speak about on the topic about mental health. Yeah. Can you introduce yourself, please, to the viewers and let them know who you are and what's the profession, please?
Yeah, my name is Douglas Misha. I'm an approved mental health professional. I've been working in the field of mental health over the past 18 years, and it is, or my involvement today is to comment basically on my personal understanding of issues in mental health where I work. I'm not going to be talking about representing anybody. It's my personal views, and as far as I know, working with people suffering mental health and their families.
Okay. So my first question, I think you might answer it in that introduction there, because I was gonna ask you, how long have you been a mental health worker?
I've been working in the field of mental health for the past 18 years. I do both adult and young persons mental health. My involvement is usually at a very critical stage when people are in crisis, and I come in to intervene to work out solutions to try to see how best people can be treated, what help they get, and we move from there.
Okay. So there's a few questions that I would that I would like to personally, and these are just my personal question that I come up with that I think I'll just ask a professional like yourself. So what percentage of your mental health clients would you say was black?
I will not answer you in terms of percentages,
Yes.
but what I need you to know is there is a disproportionate representation of mental health, black people in the mental health system. There are so many black people with different diagnoses, and there is a disproportionate representation when you look at the wider culture, the wider community setting.
Okay. So when you said this support it's on the wider community, you think when it comes to the black community, you think there's not enough in that sense where
What I'm trying to say is there are too many black people who carry a diagnosis around them for certain behaviors that can be dismissed in different cultures.
Okay. Is there any example that you could give us on that one when you said that?
For instance, we live here. If you go down to Chilton there, you will see a lot of young black people walking about, looking like they've got so many troubles in their heads. Some of them are more like zombie-like, if I can tell you, because they're on heavy medication for mental health. Most of them, you can see, I can count on my hand, say, 5 young black men, all carrying around diagnosis, taking medication. But the behaviors that brought about that are same behaviors that you can see in the other people, in the other cultures, but they never ended up with a diagnosis.
Okay. So, do you think that's to do with how the parents probably accept that, or do you think it's how it's just how down to it's just been left to just to not pay attention to it because the parents in the black community don't really not aware of the circumstances surrounding most of those diagnoses?
Yeah. There are a lot of things that our young black children do out there that sometimes as parents, people just leave the kids to do. Those things are the ones that end up people being caught up, police and all the professionals around them, and they end up being told, oh, this child has got such a diagnosis. It's just because they are led to go out there and do what they have to do. Sometimes it's the poverty in in our households and things like that. So essentially, it's just that there is I don't want to accuse our community, but I would say there is a kind of neglect of some sort where people are just led to roam without proper advice and things like that.
Well, I think it's probably the fact that most parents don't even, not even aware of the situation or the diagnosis, so they just allow certain things to just roll on, you know.
Yeah.
But whichever way, it's not good, because we're seeing our black kids and more of them going down the drain in that sense, you know.
Yeah,
It's not good.
it's not good at all.
Yeah. So do you see any rise in numbers over the years of black people suffering more from mental health? Have you seen any rise in cases? Can you elaborate?
There has been a rise, unfortunately, despite all the awareness raising
Yes.
that has been going on over the years. There have been researches done to try to get people to understand more about black mental health and the culture itself. Unfortunately, that has not really reduced the number of diagnoses in black people. So the number of,
Yeah, sorry about that. Yeah. So
yeah.
what is the three main reason why people complain, or what causes to trigger a breakdown? And is there any particular reason people complain about?
Essentially, you find in most households the support activities that could help them to kind of shape their lives, really. So you find all those things end up helping to trigger mental health.
Okay.
Yeah.
So it's a different. It's not all just it's just different reasons,
Yeah.
basically.
And the system out there, you find there are some places where up to now our black children will not want to go to because it doesn't appeal to their liking. Yeah.
So would you have any examples of activities that you'd suggest that like black parents could give their kids to like keep them any particular, like, because for example you just said like certain activities that they're involved in, like it's not what they want to, or they don't like it. Yeah. Have you got any like experience from?
Yeah, I can tell you there are in some communities where I've worked. I remember working in a community in Norfolk where there was a project which was called the Role Models Project. You know, we have role models in society.
Yeah.
So those projects would identify the role models in the society, try to pair them with kids and helping them to shape their lives. They could be role models in sport,
Yeah.
role models in any other activity.
Yeah.
Try to get the younger people involved in that as they grow up. Those are kind of activities that could help shape the future for young people, because for them to continue to fall into vile activities where they can't really learn anything new, anything helpful, nothing developmental, that really ends up affecting them in future.
And that's one of the main issues.
Yeah.
Yeah. What is your opinion on the main issues surrounding the mental health situation? And this is just your opinion. Like, that's the question before, and well, the answer you just gave us before sounds similar to this question that I just asked.
Yeah.
Anyway, but what would you have to say on that question, on this question, basically?
I would say it's the main issue, like we said, is the lack of activity, the poverty of growing up in a household where you don't access things in an equal manner with other cultures that are around you. They build up bitterness, jealousy, and things like that, and it doesn't mold children properly. So I would say my opinion is, as much as possible, the government system needs to work together with black families to try to identify what really works and what can be improved on what is available.
Okay. So you don't think that they're probably done enough work, or there isn't enough work in that field where they would know? Because like you said before, they've done lots of research in the mental health in the black community, but there's not been a lot of improvement. So do you think they're going to keep doing that, or do you think?
I think there is still a lot to learn, because you find psychiatry in itself, the field of psychiatry, that's the field of mental health.
Yeah.
I would say it's a white-dominated profession, where you find most decisions are made by highly placed
Okay.
white
Professional.
professionals.
Yeah.
And some of the decisions they make really do not affect much of the
White population.
indigenous white community.
Yeah.
It
Well,
affects the black community more.
Yeah.
And that's where we are saying working together, listening to those researches. A lot of researches have been done by black professionals, and obviously they don't easily get the kind of
Yeah,
attention
yeah.
any other professional in other culture
Yeah.
would have done.
Yeah,
So
yeah.
we still got a long way to go, but I think the basis of it is that we need to get the system learning from examples from what is going on in the communities and what research is being done by people in those communities.
Yeah. And that, because there's no one to tell the story more than the one who are feeling the actual
Yeah.
situation.
That's it.
Yeah, and this is where the problem is coming in, because the ones who are making the decisions, they haven't got any experience
Yes.
when it comes to our culture, and that's where the things. So it's not necessarily deliberately, but because they're making decisions, but it's siding to one population than the other.
Yeah, exactly.
Yeah, and it's not necessarily their fault, so we don't want to make it sound like we're saying right, but it's because they haven't got that experience.
Yeah.
Yeah, so they need to start listening to people from our culture who's made those inquiries and investigate where and what's needed, and then try to apply it in the right areas, because that's the only way we're going to move forward.
Exactly. That's
Yeah.
the way we can learn. I mean, there is always something to benefit from a participatory approach where you involve the whole community than from a commentary position where you're coming in, you are the professional, you have got the ideas, you have got everything, and you don't even consult with people, you don't take their views on board. It will not work.
So what you're saying is you have to involve the community when you're dealing with things like this.
Exactly.
Okay. Oh, it's a wider range. It's not a individual thing.
No.
It can't be.
It can't be an individual thing. For it to work, it has got to be, the community has got to see that they are being involved in it. That's the most important thing, get them involved in your decision making. And that's when you can see it will be easier for even a young black man to ask for help. Normally, you find they will not ask for help because there is that distance between the young black person and the professional coming from an indigenous culture. That makes it quite difficult.
It is. And that's where most of the problems coming in. It's more like an entanglement going on.
Yeah,
You know
yeah,
what I mean? Yeah, a culture clash.
exactly.
You know what I mean? When it comes to decision making. You know what I mean? And all they need to do is just put the right people in the right place,
Yeah, yeah.
and everything should flow. You know. Yeah. So my next question for you, Douglas, is what do you as a profession, mental health profession, think the best way of dealing with mental health? What have you got a suggestion where you'd say to someone, if you know what I mean, if they're going through a certain situation, what would you suggest?
The biggest thing in mental health is you will find that society frowns on somebody who comes presents their mental health. And mental health should be treated by like any other
Sickness,
health condition.
Yes.
Because if we look at a mental health person and we think they are dangerous, they are this, that, and the other, that's why you know the term big, black, and dangerous. The moment that is said about a young person, they are alienated from society, and mental illness itself, then it really becomes a label in a very negative sense.
So it's the labor.
It is the labeling, and it doesn't work well with our young people of today, because once they feel that way, they go into certain groupings and they do certain things that will annoy those people who are putting across such a label.
Makes sense.
And they will refuse help, because if you are negative to somebody, what help can you give them?
And then that's when they find themselves on a down and out, because now you're fighting against a whole different ball game, basically.
That's right. Yeah.
So what tips would you give to someone on how to spot early signs of mental health? Do you think it is possible for someone to spot that?
It is certainly possible, especially in families. People can support somebody suffering from mental health. One, we are going to remove the negative view, try to support them, try to be positive with them. And yes, at one point we have to accept that we have to get professional help. We get professional help. You will find in most cases in families, when people see you taking medication related to your mental health, there's a tendency to laugh at you and things like that, to say negative things about medication. It's not right. Families should support each other and make sure children are really made to know that there is a positive experience in seeking help. Because most people, when they hear you are going to the psychiatric hospital, they think, oh my God, to that place, and they come up with all those negative images, like lunatics and things like that, and that's not how it should be. It should be very positive. It just should be the same as somebody going to a physical health hospital with a broken leg. They are going there to get treatment, and they will be fine and they will be coming home. Same with mental illness. We accept that if they seek help, for instance, there are crisis teams out there, there are crisis lines, there are mental health teams. So sometimes we need to support our people to present at a time when the illness is not at the crisis point. It's something that can help to prevent the crisis and to get an individual to continue to function in their community.
So you think spotting the sign early, that would still mean of that person going to the professional to get help to sort it out, meaning be on medication XY, would they still have to go through that process, or do you think it can be prevented, as in seeing it early, like trying to be, I don't know to say, correspondent with this, what I mean, just try to be I don't know how to explain, but can that be of any treatment, should I say, the way you treat a person who is going through an episode, can that be any form of medication?
There are a lot of interventions that can happen before medication is introduced. There are things that are out there that we call talking therapies, counseling, things like that. They can help a person to structure their vision of the future and their current circumstances, and they may not need to go on to develop a crisis that would require mental health intervention.
And that would be where most people would be grateful if they could catch it at that stage, and that's where the family would need to show extreme support
and prevent them from getting to hospital.
Okay, because that's when it got to a next level, when they have to probably get certain intervention. How would you advise a family or friends to show support to the vulnerable people suffering from mental health?
I think it's the same thing. Positive signals. You should be sending positive signals all along, all the way, because in a family you will find, it could be, for instance, it could be my brother, older than me, starts to experience mental health. Other members of the family start laughing at the person and saying all negative things. As a family, you need to be talking about that, saying, obviously, this is an illness. He's going through difficult times. It's not deliberate. It's not what he wants to do. Can you support him in this way? you know, just making sure we're sending those signals, making it a positive experience for the family as well as the person who is experiencing mental health.
Because there's nothing that beats love, you know.
Exactly.
And
So
support.
nothing that beats love.
Yeah, you're right.
And
you're right.
especially coming from the family, it means a lot to anybody.
Yeah. But so this one